My name is Dr. Chahal, and I'm here to talk to you guys about Pap tests. So what is a Pap test and why do we need it? A Pap test is a screening tool for cervical cancer that looks at the cells of the cervix. The cervix is the opening of the uterus and is located at the top of the vagina. The process is simple and just requires a brush to collect the cells of the cervix that are then sent to the lab to test for cancer and HPV. So why do we test these cells? HPV, also known as human papillomavirus, is one of the leading causes of cervical cancer in females. It is a virus that infects the cells and causes them to change into cancer. A Pap test allows us to see these changes before they become high risk. If a change is seen, there are different treatment options available. A low-risk change may just require us to do a Pap test more often, and a high-risk change may require us to remove some of those cells. So who needs a Pap test? If you are younger than 21 years old, you do not need screening. If you are between the ages of 21 and 29, you need to have a Pap test every 3 years. If you are between the ages of 30 to 64, you can either have a Pap test with HPV testing every 5 years or a Pap test every 3 years without the HPV testing. If you are 65 or over, you do not need screening. If you have no history of abnormal Pap tests, which includes either 3 negative Pap tests in a row or 2 negative Pap and HPV co-testing in the last 10 years. If you have any questions or feel like you're due for your Pap smear, feel free to speak to your doctor. We're always here to help.
Go get your Pap smear!